Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Have you ever wondered what makes acute lymphatic leukemia such a formidable disease? This condition, often shortened to ALL, is a type of cancer that originates in the lymphatic system, a vital part of the body's immune defense. It's more common than you might think, affecting a significant number of people worldwide. In this video, we will delve into the causes of acute lymphatic leukemia and explore its effects on the body. So, what causes acute lymphatic leukemia? This is a question that has puzzled researchers for decades. The exact cause remains unclear, but several factors have been identified that can increase the risk. Certain genetic disorders, such as Down syndrome and Fanconi anemia, have been linked to a higher likelihood of developing the condition. Exposure to high levels of radiation is another potential cause. This could be from radiation therapy for a different cancer, or from a nuclear accident, or atomic bomb. Then there's chemical exposure. Prolonged exposure to certain chemicals, including benzene and some types of chemotherapy drugs, has been associated with a heightened risk. These factors can lead to changes in the DNA of your blood cells. These changes can result in the cells growing and dividing uncontrollably, which is what we see in acute lymphatic leukemia. Understanding these causes can help us prevent and manage this disease better. Now that we know what causes acute lymphatic leukemia, let's explore its effects on the body. Acute lymphatic leukemia, or ALL, is a type of cancer that primarily affects the body's blood and bone marrow. Its most significant impact is the overproduction of immature white blood cells, known as lymphoblasts. These rogue cells not only crowd out the healthy cells in the bone marrow, but also spill into the bloodstream, causing a myriad of health problems. One such problem is infection. Since these immature cells are ill-equipped to fight off pathogens, patients with ALL often find themselves more susceptible to infections. Even minor illnesses can escalate quickly, making vigilance and early treatment crucial. Another common issue is anemia, a condition caused by a shortage of red blood cells. This can lead to fatigue, shortness of breath, and a general feeling of being unwell. It can significantly impact a person's daily life, making even routine tasks feel like climbing a mountain. Then there's the problem of easy bleeding. With the bone marrow taken over by lymphoblasts, the production of platelets, which help in blood clotting, is drastically reduced. This means that even minor cuts can lead to significant blood loss, and bruises may appear without any known cause. As you can see, acute lymphatic leukemia can have a substantial effect on a person's health and well-being. Let's recap what we've learned about acute lymphatic leukemia. This is a type of cancer that begins in the lymphatic system, specifically the white blood cells. It's a disease that can affect anyone, anywhere, at any age, although certain factors increase the risk. These include exposure to high levels of radiation, certain chemical substances, and a history of genetic disorders. The causes of acute lymphatic leukemia are complex and multifaceted. While it's not always clear why some people develop this cancer and others do not, we do know that it's not contagious. It's also important to remember that having one or more risk factors doesn't guarantee that you'll develop the disease, but being aware can help in early detection and treatment. The effects of acute lymphatic leukemia on the body are profound. It can lead to a variety of symptoms, ranging from fatigue and weakness to fever and infections. These symptoms occur because the cancerous cells interfere with the body's ability to produce healthy blood cells, thereby compromising the immune system. Early detection is vital, as it can greatly improve the chances of successful treatment. Diagnosis typically involves blood tests, bone marrow tests, and imaging tests. Once diagnosed, treatment options can include chemotherapy, radiation therapy, stem cell transplant, or targeted therapy. Prevention, however, is a bit trickier. Since the exact causes of acute lymphatic leukemia are not fully understood, it's challenging to pinpoint clear preventive measures. But maintaining a healthy lifestyle, avoiding exposure to certain risk factors, and regular checkups can certainly contribute to overall health and potentially reduce the risk. By understanding the causes and effects of acute lymphatic leukemia, we can better equip ourselves to fight against it. It's a complex disease, but with ongoing research and advancements in medical science, we continue to make strides in its management and treatment. Thank you for joining us in this exploration, and remember, Knowledge is power in the fight against disease. UMCC, your ultimate medical consultants connectors.